Public versus private healthcare. The public system is run by government through healthcare and is paid for by taxes. Some countries that use the public health system are Canada, Australia, Spain, and many more. Public healthcare is when the country pays for the medical care of the public because they are citizens. It covers things like seeing a doctor, specialist, getting medical tests like x-rays and blood tests, taking prescription medicines, being treated in public hospitals. Public healthcare, with public healthcare, you won't pay for anything to go to a public hospital, but you might not get to choose which hospital or which doctors treat you. Also, you might have to go to a public hospital and get on a waiting list for your treatment. Although if it is an emergency, you will have to be seen right away. Medicare doesn't usually cover the full cost of doctor's visits, tests, and prescriptions, so you have to pay some costs towards these fees. There are two types of public health care used by these countries. One is single payer. That is when the government provides insurance for all residents or citizens and pays all healthcare expenses except for copays and co-insurance providers. Maybe public, private, or a combination of both. The two-tier is what Canada uses and is when the government provides or mandates catastrophic or minimum insurance coverage for all residents or citizens, while allowing the purchase of additional voluntary insurance, a fee for service who care when desired. The public healthcare system. This is used in the United States. The private healthcare system, which is used in the United States, is when the government does not provide healthcare for all citizens in the country. The private healthcare system includes things like treatment in private hospitals, ambulance trips or dentistry, eyeglasses, and treatments like psycho or acupuncture. If one gets sick or wants or needs things, you can get them through private health system and pay for them yourself with a private healthcare insurance. These are some things to remember about private healthcare system. You won't have to wait in a public hospital waiting list. You can choose what doctor treats you. If you take out private healthcare insurance to help pay for your treatment, you might have to wait a while before you are covered. Although this is used in the United States, this has been a problem because many people cannot afford to get insured. People who are in the lower strata have more physical health problems, including chronic disease. In addition, they have more mental health problems and suffer more restricted activity due to physical health problems. Also, they are a lot more likely to know about good health practices than the upper and middle class. For example, they take fewer doctor visits, dentist visits, and don't care for their body as well as those who are of the upper class and middle class. Also, they are most likely not to have insurance. Lastly, they are also likely to die at an earlier age, even when their health risk behavior is no different than those of the higher strata. Physicians rather work at a place where there are desirable resources, abundant professional opportunities, and an attractive medical community. They also would rather work in areas where they can maximize their income. But attitudes towards working with the less fortunate are overrun by where they work and the income they make. Although people of the lower class need more medical care than of the upper middle class. Obamacare is a reform that he's trying to make in the United States. This is to have some kind of universal health insurance to every citizen in the United States. Many people in the U.S. now are not insured or do not have proper insurance that they need. With this reform, people will get an opportunity for proper health care. With that said, this brings up many challenges to the community, asking how to avoid high levels of out-of-pocket payment, how to ensure coverage for medical health as well as physical health, who will pay for the cost of those who cannot afford to pay it themselves, what will be the role of the federal government, and how the cost of the universal coverage can be contained. On the other hand, Obamacare has many benefits. Obamacare's goal is to provide affordable health insurance for all U.S. citizens and to reduce the growth in healthcare spending. Obamacare does not replace private insurance, Medicare, or Medicaid. Obamacare also gives 47 million women access to preventative health services and makes it illegal to charge women different rates than men. In addition, seniors get access to cheaper drugs, free preventative care, reforms Medicare Advantage, and closes the Medicare Part D donut hole. The AARP agrees costs won't be the rise of Obamacare. If anything, the improvements to the system will decrease the average cost of health care for seniors. 1 in 2 Americans have a pre-existing condition they could be denied health insurance for. Obamacare chips away at pre-existing conditions until 2017, when there are no more pre-existing conditions for anyone, including high-risk consumers. 54 million Americans with private health care insurance now have access to preventative service with no cost sharing due to new minimum standards of Obamacare. Obamacare also states that affordable insurance means that you pay more than 8% of your annual income for insurance. Health statistics in the United States vary from those of other countries. People who are in the lower class have a lot less knowledge about health, and about 1 in 5 people in the lower class are uninsured. The United States is one of the wealthiest industrialized nations and have a health system where it is private. In 2010, the percentage of Americans without health insurance was 16.3%, or 49.9 million uninsured people. Of 83.7% of people with health insurance in 2010, coverage is 55% employment-based, 9.8% direct purchase, and 31% government-funded, with Medicare, Medicaid, and military. The primary reason for lack of health insurance coverage in 2005 was cost, lost job, or change of employment. Medicaid benefits stopped ineligibility for family insurance coverage due to age or leaving school. More than 40 million adults stated that they needed but did not receive one or more of these health services: medical care, prescription medicine, mental health care, dental care, or eyeglasses in 2005 because they could not afford it. Life expectancy at birth in the United States is an estimated 78.49 years, which ranks 50th in the highest total life expectancy compared to other countries. Lack of health insurance is associated with as many as 44,789 deaths per year in the United States. People with health insurance had a 40% higher risk of without health insurance had a 40% higher risk of death than those with private health insurance, a result of being unable to obtain necessary care. With that said, people in the United States all need to have an equal opportunity to health care, and that is why Obamacare can be the answer. References